Okay. Hello, I am Luke Bryce, and today I'll be covering respiratory emergencies. Sorry if it's a little quiet. Respiratory emergencies are critical for EMTs because they can be very life-threatening. Breathing and airway problems also are some of the most common calls we will run. Respiratory emergencies involve any condition with oxygen and carbon dioxide exchange in the lungs. Without quickly noticing or recognizing these issues, they can quickly become respiratory failure or cardiac arrest. Some of the emergencies we could run are asthma, COPD, pulmonary edema, and pneumothorax, which is a collapsed lung. Asthma is a chronic inflammatory disease causing bronchoconstriction and narrowing. Asthma could be triggered by allergens, cold air, or exercise. Airway muscle tightening, possible mucus increase and airflow decreases, then shortness of breath and wheezing occur. COPD occurs from long-term damage to the alveoli and airway from smoking or pollutants. Patients retain carbon dioxide and rely partially on low oxygen levels to breathe. Pulmonary edema happens when fluid backs up in the alveoli, often due to left side of the heart failure. Gas exchange decreases, which can cause hypoxia. Some signs and symptoms could be difficulty breathing or shortness of breath. You could also notice like redness in their face or things like that. Increased respiratory rate or increased effort to breathe using accessory muscles. You might see like their chest rapidly fall, their neck tension up, or something along those lines. Wheezing, crackles, or diminished lung sounds could also tell us important things we need to know about what's going on and why they're having the respiratory emergency that they're having. Crackles could be fluid in the lungs. Wheezing, they're having an allergic reaction to something. Diminished lung sounds, maybe they have a collapsed lung, or if it's absent lung sounds, they had a pneumothorax maybe on one side. You never know. Cyanosis, they'll get blue skin or on their face, like especially on their lips. They'll be blue. That means they need oxygen ASAP. Seeing someone in the tripod position or pursed lip breathing, they're on the tripod position. They're trying to get as much air as they can. They could also have an altered mental status from hypoxia. As EMTs, we should be able to recognize these things and act quickly. Common causes could be chronic lung disease, cardiac conditions, allergic reactions, infections, and trauma, such as rib and chest injuries. Some common treatments that we do would be, some of our airway management. Would be like a head tilt chin lift. They're on their back. You're gonna try to lift their chin up and open up that airway. If they throw up or there's mucus or there's something in their airway that's obstructing it, we can always suction it. And using an airway adjunct as needed, oral pharyngeal or nasal pharyngeal. Nasal pharyngeal, a lot of times if they have a gag reflex, because you can't have them throwing up. Some of our oxygen options to give would be a nasal cannula, which is like what you'll see old people wearing, it seems like, around like their ears. It's 2 to 6 liters, and it's for more of a mild distress. Non-rebreather for moderate and severe cases. It's a mask that goes over your whole nose and mouth, and it's 10 to 15 liters. Assist ventilations with a bag valve mask or a BVM for inadequate breathing. If the patient isn't breathing on their own or we're giving CPR, we'll use a BVM. We also are allowed to assist with albuterol and epinephrine pens for anaphylaxis. Like if someone's having an asthma attack, we make sure that they're using their albuterol inhalers. And if someone's having an allergic reaction, they're starting to tense up and not be able to breathe, we can help them use their EpiPen. We can also put them in a comfort position, which usually is sitting upright. And then we always want to make sure we monitor the pulse ox to be safe, that we aren't giving them too much oxygen, or we aren't giving them enough oxygen, or whatever it could be. In summary, respiratory emergencies require rapid recognition, and to make sure, because it's part of our ABCs, which is the main things we look for when we arrive on scene, to make sure that the airway's clear, they're breathing, and they have proper circulation, and knowing what's happening with them and how quickly we need to transport them. And then here I have a lung breakdown on my computer, because I'm not very good at editing videos. And your alveoli will be little sacs for air. And when fluid builds up, they won't be putting oxygen in the blood. And then you'll see your bronchi, it'll constrict, and if you're having like an asthma attack or something, sometimes it can make it a little hard to breathe. And then I also have a picture of a BVM or bag valve mask. You can see here where it covers the face of the person. A lot of times we'll hold it tight with a C grip and grip under their chin. This is where we can hook oxygen up to it if needed. And this is where we squeeze. But when we squeeze it, we want to be sure we're not squeezing it too fast or too hard or too much, because we don't want to cause any more damage by rupturing a lung or anything like that.